All right, we're back at it again for week number 4, and I will be talking about ethnic and racial disparities, along with the vulnerability determination, and along with some federal programs that have been identified to combat these disparities. So we'll talk about vulnerability determination, vulnerability characteristics, racial and ethnic disparities, Fed programs that have been put in place to eliminate these, and enabling characteristics. Vulnerability. It doesn't represent a personal deficiency. It represents the effects of interactions between multiple factors over individuals who have little or no control over. For example, if you have a child that is homeless, or a child that is in poverty, or a child that's dealing with child hunger, they have no control over their circumstances or their environment. Vulnerability determination, predisposing, enabling and need characteristics. Some of the characteristics that have been identified, why particular groups are suffering with disparities: homelessness, insurance status. You have many people that are uninsured, gender and age, mental health, chronic illness, and AIDS and HIV. Here are some of the ethnic and racial disparities that have been identified by each class. African Americans have a shorter life expectancy. A lot of that has to do with poor eating. We have poor eating habits. We eat a lot of food that carries a lot of fat, that clogs up arteries. Not saying that all don't, but this is research that has been found that dealing with heart attacks, hypertension is more prominent in African Americans than any other group. We're also economically disadvantaged and more likely to smoke cigarettes. Okay, Asian Americans, they suffer with bipolar distribution of education, income, and health status. Korean Americans have a fivefold incidence of stomach cancer compared to other races. They also live in poverty by close to 12% more than any other race. American Indians and Alaskan Natives, they're at the bottom of the social economic status. Their death rate due to alcohol is 7 times greater, and their suicide is 3.5 times greater than any other race. It's pretty alarming. Here are some federal programs that have been put in place to fight these disparities. U.S. Department of Health and Human Services have 6 key areas in their initiative: infant mortality, cancer screening, cardiovascular disease, diabetes, AIDS, and immunization. They offer free health screening and free vaccinations for children. U.S. Office of Minority Health. This mission was implemented to improve the health of racial and ethnic minority populations through the development of effective health policies and programs that will eliminate disparities. This program was launched by the Center for Disease Control and Prevention in 1999, and it was aimed to support the goals of Healthy People 2010 to eliminate racial disparities in health and health care. Indian Health Service, an agency within the Department of Health and Human Services with the mission to be the principal advocate provider of health services to American Indians, and Alaska Natives. Enabling characteristics: uninsured and homelessness. You have a lot of ethnic groups that do not have basic insurance. They don't have health insurance. Even though the Affordable Care Act is currently available, they still have not signed up, and so that's why it's important for programs to be put in place that assist them with signing up for the Affordable Care Act. Homelessness, they need more programs. I know here in the Knoxville area, there's a program that is called Homeward Bound, and it is a federally funded program and initiative that they are determined over the next 20 years to get 200,000 homeless people off of the street. And so basically you go in for an appointment and they put you in an apartment with a reduced rent. They help you with furniture, they help you with clothing, they help you with different things like that. If you have children, they will assist you with your children as well. And so these are just some of the initiatives I think it's important that in order for these disparities to be eliminated, there will have to be a continual drive of these initiatives, these programs that have been set in place to fight disparities. But also, it's going to be important for the government, and it's going to be important for education, proper education, that people are properly educated, and so they can understand and know what's available to them. Also, need characteristics: mental illness, chronic illness, disability, HIV, and AIDS. And here are my references. I thank all of you. I did go a little bit over my 3 minutes. I hope that y'all were able to get something out of this. And until next week, y'all have a wonderful evening.